Hello everyone, a very good evening to all of you. So in the morning session, we talked about a few cardiovascular disorders, and we have just talked about 4 to 5 cardiovascular disorders, the most commonly asked concepts for the NEET and INI-CET MDS. So we are going to solve MCQs from the morning session. Okay. So hypertensive emergency is about. See, we have talked about what is primary hypertension. If you have not watched the video, I'll just give you the link. You just go and watch it. Which we talked about secondary hypertension. We talked about hypertensive crisis. So what is hypertensive crisis? If the systole and the diastole is more than 120 bar 180 bar 120 mmHg, I'm going to call that as hypertensive crisis. So imagine if the hypertensive crisis is along with end organ damage or target organ damage, then that is going to become hypertensive emergency. These patients should be immediately taken to the hospital. So hypertensive, there is something called as hypertensive urgency. So hypertensive urgency is without target organ damage. If it is associated with the target organ damage, then that becomes emergency. So this is urgency. This is emergency. Okay. So hypertensive emergency is 180 bar 120 with target organ damage. So moving on to the next MCQ, a 35-year-old woman has a BP of 170 bar 110 mmHg. So she's pregnant and she has pedal edema plus proteinuria. Moving to the morning session, what is called as preeclampsia. So preeclampsia is one of the cause of secondary hypertension. Okay, so it is one of the cause for secondary hypertension, and the most commonly associated three triad with preeclampsia is there's going to be hypertension plus proteinuria plus there's going to be pedal edema. So this is a classic of preeclampsia. So pregnant patient, pedal edema, proteinuria, classic of preeclampsia, which is one of the causes of secondary hypertension. So 68-year-old man suddenly develops right-sided weakness. Okay, slurred speech. There is no headache or there is no severe headache, and blood pressure is 150 bar 90. See, when the patient is having any kind of hemiparesis, okay, patient is having hemiparesis, one-sided failure will be there, and the patient is having slurred speech. Okay, this is a classic of ischemic stroke. So ischemic stroke patients will not have a headache. Okay, these patients will have hemiparesis, slurred speech, facial drooping, whereas hemorrhagic stroke patients will have headache, vomiting, and also these patients will have unconsciousness. Okay, so right-sided weakness, slurred speech, and there is no headache, classic of ischemic stroke. So decreased blood flow to the brain results in death of the brain. That is ischemic stroke. Rupture of the vessel wall due to hypertension or aneurysm, that is hemorrhagic stroke. Okay. Now moving on to the next MCQ. A 55-year-old woman develops severe headache, worst headache of the life. Moving on, hemorrhagic stroke, severe headache, unconsciousness. Patients will have, the patients will have vomiting. So these are all the most common features of hemorrhagic stroke. Okay, subarachnoid hemorrhage. What is lacunar infarct? Lacunar infarct is, the small arteries, disease of small arteries. Okay, hypertension. Diseases of small arteries. Lacunar infarcts. Okay, so patient having headache, vomiting, unconsciousness, hemorrhagic stroke. Patient having one side paresis, that is hemiparesis. Patient having slurred speech, facial drooping, ischemic stroke. Okay. Now moving on to the last MCQ. A 72-year-old man, patients with atrial fibrillation, suddenly there is left side weakness and the CT brain is done immediately. What is the first investigation to differentiate stroke? As I told you, any patients who comes to you with symptoms or signs of stroke, the first thing you should do is a non-contrast CT brain. So in the non-contrast CT brain, you should find whether the patient is also having bleeding or there is no bleeding. Okay, if it is because of bleeding, then I will lower the BP and stop the anticoagulants. And if it is no bleeding, if it is not because of bleeding, that is, it means it is because of ischemia, then I will give anticoagulants. Okay, this is how you should treat the patient with stone. So with this, we have discussed the MCQs and the concepts pertaining to cardiovascular system. So thank you so much for watching the video. Have a nice day.